I am Dr Yeshwant Mane from Atharva Infertility Center, Nashik. We face many couples who come to the clinic and they ask a very frequent question. Doctors, when all the reports are normal, my blood reports are normal, my semen report is normal, even my wife reports are normal, still we are not able to conceive in spite of trying for such a long time. And in fact, they have had treatment at multiple centers including ovulation induction, multiple cycles of IUI, and some cases also had IVF treatment. In spite of having so much of treatment and having absolutely normal reports, these couple failed to conceive. So this is, in medical terms, is called as unexplained infertility. For a female to get pregnant, three basic factors are required. One, she has to be ovulating at monthly intervals. That means she has to produce one healthy egg. Second, she should have at least one patent fallopian tube. And the third and the most important, the husband should have a normal semen analysis. When all the three factors are normal, and if the couple fails to conceive, then they are classified as having an unexplained infertility. Now let's look into factors which are responsible for causing these problems of infertility. Unexplained infertility, like as I said some moment ago, like in spite of having a normally ovulating egg, a normal semen parameter and a patent tube, these couple fail to conceive. And when we go into further evaluation of this couple, majority of the cases of unexplained infertility, the diagnosis can be made only during an IVF cycle. During an IVF cycle, we will be able to analyze the quality of the egg, quality of the sperm, and the most important thing, like men of late, we have seen increasing cases of increased DNA fragmentation index in the semen parameter. Any semen parameter having a DNA fragmentation index of more than 25, these sperms are not suitable for fertilization and for a healthy pregnancy. During an IVF cycle, when we analyze the cumulus oocyte complex from the follicular fluid, we tend to see the quality of the egg, the quality of the cumulus. When we denude the oocyte, then we assess the quality of the egg. During the ICSI procedure, we will be able to analyze the egg, whether the egg is having some selective endoplasmic reticulum or vacuoles in the oocyte, and the fragility of the egg, which is assessed during ICSI. Many cases with unexplained infertility, they have fragile eggs. One. Second, if you take into consideration the male partner, many males have a sperm without the acrosome. Now, acrosome is a cap in the sperm's head which helps in dissolving the zona and facilitates the entry of the sperm into the egg. So such types of sperms are not suitable for healthy fertilization. So these types of factors we can easily assess during an IVF cycle. The quality of the egg, the quality of the sperm. When we do ICSI procedure, we check for fertilization around about 16 to 18 hours. Then we assess the quality of the zygote and the quality of the embryo in subsequent days. Now the egg has to fertilize at periodic intervals, like 16 to 18 hours it has to form a zygote, then after 24 hours it has to form a 2 cell, 4 cell, 8 cell, and so on. And by the time the embryo reaches day 5, the speed of cleaving of the embryo has to be uniform. So in IVF cycle, we tend to assess the cleavage speed of the embryo. Some embryos, they tend to cleave slow. So these are slow growing embryos, and sometimes the slow growing embryos are also responsible for infertility. On the other end of the spectrum, we tend to see some embryos are fast cleaving. That means they are genetically abnormal embryos. So a slow growing embryo and a fast growing embryo, they are usually associated with increased genetic abnormalities. Apart from this, the most important thing which we tend to assess in an IVF cycle in patients with unexplained infertility is they have some implantation problem. Implantation problems, when we assess the endometrial cavity, the endometrium during the time of transfer, we see certain things. One is the thickness of the endometrium. It has to be anything between 7.5 to 12.5. It should not be less than 7.5. It should not be more than 12.5. It has to be a triple line endometrium. Third, it has to be a endometrium with good blood flow. Unless the endometrium doesn't have a good blood flow, it is very difficult for the embryo to attach into the uterine cavity. So these are the things which we tend to find in cases of unexplained infertility. And the most important thing in cases of unexplained infertility we tend to find during an IVF cycle is a bad quality egg. When you get a bad quality egg, so it is not possible for them even with IVF cycle to get pregnant. So this is in short the factors responsible for unexplained infertility, how to diagnose them, and the treatment modalities we'll definitely see in the next video.